Here are the 5 most important keys to avoid surgery and heal an ACL tear. Number 1 is use a knee brace. I mean a knee brace like this one that has hinges built into the brace on either side of the brace. This is critically important because the function of the ACL is to give your knee stability as it's moving, as it's bending and straightening, especially in the halfway motion, like when the knee is partially bent. And if your ACL is injured right now, then it can't do its job of giving your knee stability as it's bending. So you need external help to get stability. That's why the hinges are important. You don't get a brace that's just a sleeve or that has the flimsy struts, the struts that don't have a hinge in there, but they kind of offer a little tiny bit of stability, but it's not going to be enough compared to the hinged brace like this one. When you get that external stability, then it gives your ACL a chance to take a break and not have to provide stability, which will give it a chance to then heal. Another added benefit of using the brace is if you have swelling, the compression of the brace can assist you in getting that swelling down. Number 2 is to offload. And what I mean by that is to make sure that you get pressure off your leg by using something like crutches. Crutches are going to be the number 1 option for most people, although using a cane or a walker can be helpful too. But using crutches like these and keeping your toe on the ground on your injured side. You don't have to hold your leg up all the way, but just toe touch so that you can still put a little bit of baby pressure through your knee. I tell people, think of it as 99% of the body weight on your good leg, your leg that's okay, and just 1, 2, not more than 5% at the start on your injured leg. And as you gradually get better, put a little bit more pressure through your toe based on how you feel. If you can do it without having any pain, then go ahead and put some more pressure on it. And the more pressure you put, the better. Which leads me to number 3 is to keep moving. You have to keep moving, you have to keep active, because when you get an injury like an ACL tear, the tendency is to baby it a lot and not even move the leg, but then your muscles are going to get weaker. But if you keep moving by touching your toe on the crutches, or even when you're just sitting around lying down, bend and straighten out your knee within a pain-free motion without straining it, without causing any problems, then this is going to keep the joint healthier. This is going to allow the muscles to lengthen and shorten. And you're going to have to use the muscles to some degree, so it's going to keep them active, which is going to reduce the amount of atrophy that you might suffer from the ACL tear. Number 4 is to fix the muscle imbalance. Once you start to heal that ACL, then you have to start to consider fixing the root muscle imbalance that might be putting excessive tension through your ACL. This is usually caused by over-dominant quad muscles and weak foot muscles, usually the toe muscles, the ones that curl your toes. As you get stronger in the glutes up in the hip, it allows the quads to quiet down and not put some bad forces through your knee joint that can put some excessive tension through your ACL. And then as you get your toes stronger, it helps your arch to come up so that it gets your knee in better alignment from the bottom up. By fixing the muscle imbalance, you can take tension off that ACL so that as you get back to being active, as you get back to walking, as you wean off the crutches and get out of the brace, your ACL is going to be as healthy as possible moving forward. The 5th key is to strengthen your legs properly. You need to make sure to get even stronger in those glute muscles and in the foot muscles, because the stronger you get and you practice normal, good quality movements, then you're going to put your ACL through the right loads, which is going to thicken the ACL or give it better integrity at the cellular level, the level of the cells, so that it can take a bad hit from time to time and you'll be just fine. Staying strong in the right muscles gives you the best outcome for the long term, so that you can get back to running, playing sports, even being competitive in sports, and you're going to be confident that your knee is not going to be re-injured. If you need help with a process to fix the muscle imbalance, to get the right brace for yourself, to understand how to use a brace, to understand how to offload, to figure out the time frames for all this stuff, I have packaged all this information using my treatment approach in a program called the ACL Tear Recovery Program. There's a link to it in the description below. This program is over 40 videos long of me walking you step by step through a process to naturally heal your ACL so that you can avoid surgery. Or if you've already had a surgery and you're done with the doctor, you're done with going to physical therapy, but you're still having some problems, then chances are that this program is going to be huge for you to improve the little things that you needed to improve that just didn't get addressed during your rehabilitation and during the surgery. Go check out that program in the link below. And I've also got a playlist of all our ACL videos. It's called the ACL Tear Help Playlist, so you can learn more about our approach to helping an ACL tear heal naturally. Hey, thanks so much for watching, friends. If this video was helpful for you, give us a thumbs up. Please drop a comment in the description below as well. Let us know if this video helped you there. If there's something that you want to ask us, please ask. We'd love to get back to our comments. And please subscribe to our channel and turn on our notification bell if you haven't yet, so that you don't miss out on any of the helpful videos that we post each and every week. Thanks so much for watching, friends. I'll see you in the next video. Bye-bye.